57-year-old female here for right shoulder pain. Most of her pain kind of over the superior aspect of the right shoulder, but she does have some vague discomfort in the biceps musculature, as well as some stiffness and discomfort in the right wrist going into the hand. Exam is consistent with some mild limitation in motion and impingement type symptoms. We can go ahead and do an ultrasound of the right shoulder today. Here we're going to go over the subdeltoid bursa injection. Here we can see the deltoid muscle with origins from both the clavicle and the scapular spine. You can see how it overlies the infraspinatus and teres minor muscles. Now we're making the deltoid muscle translucent. We can see this fairly broad bursa, which is the subdeltoid bursa, which is the target of this procedure. This is an in-plane approach, and here we are essentially going right into the bursa, and here we are continuing with the injection. Here we're looking at the subscapularis tendon. You can appreciate on its proximal aspect that it's a little bit thicker than its distal aspect, more so than you would expect normally, and I believe there is some tendinosis of this region of the subscapularis tendon. Now we're switching to a short axis view. We could actually see it a little bit better, maybe some intrasubstance tearing as well, but again, the muscle fibers of the subscap go quite distal, so you don't want to confuse that with just muscle. Now we're going to look at the supraspinatus tendon. Here you can see the biceps tendon, so you know that you're in the interval. You can see that superior facet, which is quite irregular, which clues you into some sort of tear of the rotator cuff of the supraspinatus tendon. And here you can see a intermediate grade bursal sided tear of the supraspinatus tendon, and also there's a concavity in that bursal surface of the supraspinatus tendon distally, consistent with a bursal sided tear. That dark signal under the tear, I believe, is just anisotropy. As you toggle the probe, that goes away. Might be a little bit of punctate calcification just under that bursal sided tear, which you can appreciate here. Here we're basically at the middle facet of the greater tuberosity. Now we're going to look at this in a short axis view. Again, you can appreciate the significant irregularity of the greater tuberosity. You can see the dimpling or concavity of that supraspinatus tendon where the bursal sided tear is located. Now we're going to look at our infraspinatus tendon. See the humeral head on the left. And here she has a very thin infraspinatus tendon, consistent with degenerative tearing. I don't think it's completely torn. You can appreciate the tendon a little bit better here in short axis. And then as you follow the tendon distally in short axis, you do appreciate an infraspinatus tendon, but it appears quite degenerative and thin as to what I would expect it to normally be. Now we're starting the injection. Here you can see the needle going right into that subdeltoid bursa. You have to get under that subdeltoid fascia, which is at the underbelly of the deltoid muscle. Pretty good reverberation artifact as well. And here we're starting the injection. You can start seeing the needle tip a little bit better as you inject, as that dark anoic fluid surrounds the needle. And here you can see basically this kind of contour sign, I would call it, where the air from the injectate actually contours the surface of the tendon, which you see nicely here. And another thing, I usually have patients supine during these procedures, but this patient preferred to be sitting.